will just quickly run through who I am and my disclaimers. So I'm Eloise. I've been a UK pharmacist for 20 years and I'm passionate about making sure everybody understands all their medicines and supplements. So this is for entertainment and educational purposes only. Please don't take this as a personal healthcare advice and always go to your own healthcare practitioner. And I will do my best to make sure that everything is up to date and most clinically relevant, but be aware that I am in the UK and the legislation between different countries worldwide do vary. Oh, hello DC and Patricia and Eva. Yeah, it's great. If you're just listening, that's fine. I am quite slow at keeping up with the chat anyway, but I will do my best for that. So some of the different subjects that people have asked me to talk about is vitamin B17, vitamin B6, dog wormers to treat cancer, mushroom supplements to treat cancer, and does melatonin work? So is there any one of those that anybody wants me to start off with? Hello, not that Kate. And Tanya and Kay Marie. Excellent. Doing great. I've got 8 people online and 11 likes. So that's ace. The B vitamins. Right. Well, I'll start with the easy one. B17. So B17 doesn't actually exist. It isn't actually a vitamin. It is a substance that is found naturally in nuts, bitter almonds, apricots, and cherry seeds, and it's called amygdalin. And it has been used. So amygdalin has been turned into a supplement of laetrile, and it's been used since the 1800s to treat cancer, except for the fact that there is no evidence that it actually works. So it's processed by the body into cyanide. And yes, cyanide does kill cancer cells. Unfortunately, cyanide isn't actually that directed to cancer cells, that it's also not very good for the actual body. So if you would actually get it in enough concentration in your body to actually be damaging cancer cells, it would actually be damaging the actual human body as well. So the side effects of it are that of the side effects of cyanide, which is fever, sickness, dizziness, liver damage, nerves damage, coma, and death. So there was a big study done back in the Cochrane Library, did a systemic review of all the different trials and studies that they could find on it. And Cancer Research UK have also looked into it. And there is no evidence that it actually works in helping against cancer. And it is banned in the UK, in Europe, and in the US by the FDA. So hopefully that answers all the questions you've got on B17. But yeah, if you've got any more on that, just let me know. Oh, hello. Is it Sean? Yeah. Oh, Tanya, your son, Sean. Okay. Okay. And Nikita, welcome as well. Excellent. Somebody's finishing my supper. My daughter's just finished eating her tea, but I'm waiting until after the live until I eat my tea. So obviously it's 6 p.m. over here in the UK, but I understand it's lunchtime over in the US. And if I've got anybody from anywhere else in the world, it'd be lovely to hear from you. Oh, I'll wave to you, Sean. Right, so Mr. Ranger. Right, so vitamin B6. So this is another common supplement that's it's common in multiple supplements. It seems to get put in there. It's even put in energy drinks, vitamin B6, along with some of the other vitamin Bs. So all of the vitamin Bs, they're not actually a class. The only thing that's common within them all is that they are vitamins and that they're water soluble. That's about the only common element between all the different B vitamins. None are stronger or weaker than any of the others. They all just have different functions. So this comment that vitamin B17 was a strong B vitamin, it's not. Each number is just when they were found. You'll find that not all the numbers are used, because as they named a chemical a B vitamin, they then found it wasn't. So it got taken off the list. So now, not all of them have numbers allocated. So vitamin B6 is pyridoxine, and it's needed for, well, it's used in over 100 different enzymes. It's used for brain development, nerve development, immune function. It's just basically needed by all our cells in the body. And usually we need it in quantities of about 1 to 2 milligrams a day. It's prevalent in chicken, fish, potatoes, lots of different fruits, especially the non-citrus fruits. So it's widely available. We need 1 to 2 milligrams a day, and we can actually tolerate up to about 100 milligrams a day if we've got functioning kidneys that can actually excrete it. So a lot of people that are taking vitamin B6 supplements over and above what they need are just excreting it as expensive urine. So it's not really much benefit to taking extra in supplements. If you haven't got a deficiency, you just make an expensive urine. However, if you were to be up on that maximum dose of the 100 milligrams for several weeks or months, then you can actually have long-term damage from too higher levels of vitamin B6. It can actually cause nerve damage that can actually damage the nerves that control your body, so you can lose body functions, and it can also affect the skin, causing dry patches and sores on the skin and sensitivity to light. So, and I have heard of various cases of people with vitamin B6 overdose. So it's something to bear in mind. So yeah, so there are some classes of people that do actually need to have more vitamin B6. So some people with low kidney function, they actually do need more. People with autoimmune disorders such as Crohn's, rheumatoid arthritis, they need more. And people with alcohol dependence need more because they don't absorb it as well. And also there are some anti-epileptic medication that reduce the absorption and use of vitamin B6, and they need more. As for treatment of needing of B6 being touted for treating lots of things, so they did find that people who have low levels of cognitive function have lower levels of vitamin B6, and so elderly people who have managed to keep up with high levels of vitamin B6 in their diet do have higher levels of better memory. However, they then tried giving supplements to people with dementia, and it doesn't do actually anything to actually treat dementia or reverse it. So the same with cancer. They did find that people with low levels of vitamin B6 sometimes can be more at risk of certain cancers. However, actually giving a supplement of B6 did nothing to actually reduce the risk of getting cancer. So whether there's a cause or effect is unknown. But the two places where there does seem to be a bit of benefit is, one is in nausea and vomiting in pregnancy. Making sure that you have enough vitamin B6 there does seem to help stave off the nausea a bit. And also with premenstrual syndrome as well, so making sure that you've got enough B6 can sort of limit the symptoms of that. But again, no cure, just help limit the symptoms. So I hope that gives a nice overview of vitamin B6. So, right. I'm just having a read through the comments. Hello, Shelby, as well. Yeah, so lupus is an autoimmune condition, yes. Yeah, so excellent. Right, so two of the topics of discussion in other people's lives and videos recently have been of certain supplements to try and help with cancer. And one of the ones I laughed at first was the dog dewormer. And I'll just answer Kay Marie. Yes, so the vitamin B6. I had a look up of the McArdle's syndrome. Very interesting. It's not something that I've ever come across. So when it's using it for a condition such as yourself, your body is needing to use it. So the doses of the 100 milligrams a day for you is the recommended dose, and that is fine. So actually, sort of with kidney issues, you actually do have a higher need for it. So again, I wouldn't worry about that. And yeah, a very, very interesting condition, sort of how your muscles can transfer from glucagon to glucose. You did mention in your previous comment about whether you wanted to balance with the different vitamin Bs. You don't need to. Supplementing with the vitamin B6 isn't going to affect your absorption of any of the other vitamins. Each of them are their own, so you don't actually need to worry about supplementing with any of the other B vitamins. Just carry on with that one, and with hopefully as healthy as possible diet around that to support that. Okay, yeah, so the dog dewormers, in humans. Yeah, well, my first response was to laugh at it. But I actually did do some research to actually find out where this had actually come from. And there had been a Korean man who had been recommended by his vet to try the fenbendazole, which is one of the dewormers. And that's because there are two sister drugs to fenbendazole, which is mebendazole and benzimidazole. One has been looked into for the use against pancreatic cancer, and one has been looked into the use for breast cancer. And they are looking alongside tests, and they are showing potential benefit in the lab and potential benefit in mice. But they have yet to be able to get any decent human studies on them actually being used. So this one bloke, on recommendation from his vet, not his cancer consultants, did take this dog wormer alongside his chemo and his radiotherapy and got into the remission. But after he went viral on TikTok and Twitter saying that he'd done this, he then did actually stop the dewormer and said that he didn't think that was what was caused any benefit, so he'd stop using that. But he'd had chemo and radiotherapy alongside, and when you're doing multiple different interventions, you can never actually find out which one it is. All I can say is that there is research being done around these agents. These are agents that Big Pharma already have in the system, making lots of money from animals with them. So if they turn out that they do actually help in any different type of cancer, they are going to then patent them slightly differently, even more expensively, to fight the cancer. So if there is going to be anything use, it is going to be used. But what I do find quite conflicted is the people that are looking for this is because they don't believe in Big Pharma or chemo, yet then they're wanting to use an agent that is actually being developed by Big Pharma to treat dog worms. So it seems to be a conflict. It's not even going back to something more natural when you're then going to try and use dog dewormers. So yeah, that one is quite a weird one. But I would just say dog medication, animal medication, they're totally different from human medication. The way that animals metabolize different drugs is totally different to us. Their livers and kidneys process things totally different. One thing you probably are aware of is chocolate. We can metabolize chocolate, although it's not healthy for us in large quantities because of the fat and the sugar content. The actual cocoa bean isn't actually dangerous to us, yet it can be fatal to cats and dogs because they metabolize it differently to us. I'm very aware with owning rabbits that lots of agents that I think are fine isn't fine for rabbits. Iceberg lettuce, do not feed that to your rabbits. It's not good for them at all and can be toxic for them. And then there's other things like thyroid. My cat, I did have a cat that was hyperthyroid. I'm as healthy as a horse as well, Shelby, and I consume large quantities of chocolate. I'm just saying potentially the sugar and fat content. But yes, I had a cat that was hyperthyroid, and in cats, they metabolize thyroxine in their half-life. So the half-life of the thyroxine in the body dropping to half the level is only 12 hours in a cat. It's more like a week in humans. So the dosages that are needed are totally different, even taking into account the weight of an animal. And things like even between animals, meloxicam, which is used in humans as a painkiller, a non-steroidal anti-inflammatory painkiller, it's also given to dogs and cats and rabbits, but the dosing is totally different. It's not just weight dependent. A rabbit actually needs 6 times the amount per kilogram to a cat. So when you're actually giving a rabbit that might be smaller than a cat a dose of meloxicam, they actually need 6 times the amount, and they actually need to be using the large dog preparation. So you can't just convert from the size of an animal into a different animal. They're all totally different, and veterinary pharmaceuticals is very, very complex. All right. Oh, wow, I seem to have already covered quite a lot, and we're only 20 minutes in. So any other questions on those 3, or are you all ready to get interested in mushrooms? So again, mushrooms to start with. I thought, I wonder, but actually, Big Pharma are very, very interested in mushrooms. But you can't just say mushroom supplement. Mushrooms is a term in the same as saying plants. There's hundreds, maybe even thousands of mushrooms. And then within each mushroom, there's lots of different chemicals in there. So when you're actually thinking of all these different chemicals that are in mushrooms, you're getting onto thousands of them. And there are some of the ingredients in mushrooms that are potentially absolutely fantastic, and some that are potentially very, very fatal. So I'm probably sure that most of you are aware of the 2 most common: the magic mushroom, which has its psychedelic activity. So it does have a psychedelic causing ingredient in there. They have actually been studying magic mushrooms and for the psychedelic effect. They've actually extracted the chemical that causes the psychedelic action, and they are actually purifying it and looking to use it in the treatment of PTSD. So there is so there may be the potential that could be a good use of it. And so Big Pharma are already on looking at the mushrooms. So that study is very interesting. You've then got on the opposite extreme to that, but it does look fairly identical. So if you are walking in the woods and you think you know what a magic mushroom looks like, still don't go and go and pick them up unless you really, really do know your fungus. Can't remember what the name is for the people that look up that know all about the fungi. But death cap is very, very similar, and obviously death cap goes by its name, and you only need to eat a few of those and it is deadly. So I never recommend, unless you actually do that for a living and understand mushrooms. Never go picking your mushrooms. Mycologist, that's it. Yeah, I do actually have a friend who, well, he was one of the doctors that used to work in one of my practices, and he's now retired, but yes, he's a mycologist. Yeah. Well, I've lost my train of thought. So death caps, stay away from them. But then when we get onto our normal mushrooms, we've got your butter mushrooms, your chestnut, your flat mushrooms, all of them, including them in a healthy, balanced diet, are very nutritious. They contain essential amino acids. They can, if they've been left out in the sun, they can actually provide a good amount of vitamin D, which is brilliant. And they also can provide one of your sort of micronutrients, your chromium, which is needed for your body to produce insulin. People then say that mushrooms would actually help with diabetes. It doesn't. It just supports in your own body's production of insulin. So if you're deficient in it, you may have a problem, but it's not going to cure anything. Yeah. Okay. Patricia, I've just seen your comment come up. Yes. So allergies. You can actually use human antihistamines in animals. Obviously, double check with your vet. But I do know that a half tablet of either loratadine or cetirizine is suitable for our cat when she has allergies. She gets allergies to random things. She gets stung by bees because she likes to play with them. So yeah, so dogs and cats can have human antihistamines, but obviously, always if you've got a very small or a very large cat or dog, you may want to just double check the dosage with your vet. But yes, that they are suitable. So it is always useful just knowing which ones are suitable. Then when it comes to lots of other different mushrooms, there are lots of mushrooms that have been used in Chinese medicine for hundreds of years. So yeah, I was going to say mushrooms are, some people think they're like slugs and just can't cope with the texture. Personally, I love them. My daughter's on the fence with them, so I usually end up with a whole amount on my plate, and she just has a few. So especially when we go for a Chinese, I love ordering the mushroom version of anything. But yeah, the Chinese have used mushrooms in Chinese medicine for decades, and now Big Pharma is also looking at all the different chemicals within mushrooms to potentially use them. One that actually I've got a lot of interest out of looking for was the shiitake mushrooms, which my daughter was very into sort of MasterChef and things. So when she got to a age she was learning how to swear, she learned how to say shiitake mushrooms, which was always quite amusing. But yeah, so shiitake mushrooms, they contain something called laetrile, which is a beta glucan with complex sugar, and it has been known to stimulate the immune system and trigger your own body's cells and proteins to actually help fight against cancer and help slow the growth of cancer. And there is doing some research into looking at this. They have been looking to use it alongside chemotherapy and radiotherapy in people with lung cancer. They've had 12 studies already on it, and it does show that it seems to improve the quality of life for people. But again, it improves the quality of life of those people going through the chemo. It doesn't actually extend life or cure the cancer or provide. It's just something else that's potentially used alongside. And again, there's quite a lot of other mushrooms as well that are good for using alongside chemo with radiotherapy. And in all the studies that I read about the use of the mushrooms, it was always to be alongside chemo and radiotherapy in helping. But One thing that they have found with the shiitake mushrooms, it does improve the immune system and causes the immune system to be more active. So they have found actually causes problems and increases the symptoms in people with multiple sclerosis, lupus, and rheumatoid arthritis, because actually having too much of an immune system can be a bad thing. So those people with autoimmune disorders, you do actually need to therefore be careful about supplements that might actually be boosting your immune system. Again, so there was a few others, and I can't pronounce half of these because I'm not a botanist. I'm quite good at most of my drug names, but when it comes to plant names and botany, not so much. But there's a reishi mushroom, again, a small benefit on top of sort of chemo and radiotherapy. And agaricus salvatacus, again, after bowel cancer surgery, they found that it slightly improved the quality of life of people. It made them feel less sick, less aches and pains, slightly better sleep, slightly better appetite. So, again, just a supplement for all sort of better well-being, not actually for treating cancer or being a magical cure. And again, there was another one, phellinus lintes, which was it helped show that slows the growth of cancer cells in the laboratory. So yeah, so there may be the potential for some mushrooms. However, I would not suggest be getting these ridiculously high doses of supplements to take, where you're literally only taking that in massive supplement doses. And I definitely would just be buying supplements that you can buy in your own local supplement shop at a reasonable price. Just be looking in sort of the 10 to 20 pound mark, or the $10 to $20 mark. Not that some of these supplements that you get from these companies where they're charging hundreds and thousands of pounds for them. There's just no need. Even big pharma, when they extract the chemicals from it. I have just been got by my cat Minnow. I bet you'll get all the likes. You will. She never normally jumps up on the table, so that's only because I'm talking on it here. Yeah, she's the crazy kitten. Even though she is 3-year-old, we still call her the crazy kitten because she's never growing up. Yeah. So it looks like the majority of people don't particularly like. Yeah, so Nikki, so there was some of the mushrooms showed to be good for inflammation. Again, I would, if you are looking into doing taking one, look into the research of it. Know that none of these supplements are ever going to be a magic solution. If there were a magic solution, Big Pharma would be making their money out of it. So, yeah. Oh, cheese in mushroom. Personally, I'm allergic to cheese, and I've got a totally different cheese allergy to anybody else. I'm not allergic to lactose. Lactose causes no problem for me, but for some reason, when cheese is melted and the oil comes out of it, my body then just doesn't tolerate it and it makes me sick. So not very good, but it's not lactose, although I have moved away from drinking milk just because I don't get through the quantity of milk. So it's easier for me to have coconut milk in the fridge because it doesn't go off as quick. But that's nothing to do with health or that thing. It's just purely for, I don't get through enough of it. My daughter doesn't like milk, so we just think. It's not that sad. I don't eat. I still eat pizza. I just order one with no cheese on top. So I still managed to eat plenty. Oh, I love the crunch of water chestnuts. Yeah, but yeah, I am very much texture. I'm very much sort of texture reverse to sit different things, and I'm very much, I do like different things different areas of my plate and don't like certain things mixing. Yeah. Nikki, I did look into almond milk, and to me it tastes about the same as coconut milk. But then when I did actually look into the amount of water that's needed for creating almond milk, coconut seemed to be less, so I thought I'd go with coconut. But I think, you know, that they're all pretty much the same. Yeah. Weird and proud. There's nothing wrong with being weird and proud. Yeah. We've got to, you know, take on board our quirkiness. One of the other questions I got asked was about melatonin. So I don't know whether the person that asked was from the UK or the US, and obviously there's very different rules in regards access to melatonin. So in the US, it's classed as a supplement and can be bought over the counter. When I actually visited the US about 20 years ago, I did actually buy some over the counter so as to use it for jet lag when I got back. Whereas in the UK, melatonin is prescription only and has quite a lot of restrictions. And the majority of people are finding it very, very hard to get hold of melatonin in the UK, even if it does provide benefit for the children. So there has been studies on melatonin. It does work, but I think you need to understand what it is to understand potentially when it will work. So you have what's called a circadian rhythm during the day. So just before you wake up in the morning, your body should have a release of cortisol to wake your body up. And that should happen about half an hour before you wake up. Your body, your adrenal glands release cortisol and provides the energy for you to wake up in the morning. Some people have a nice boost of cortisol in the morning. Those are those morning people. I don't get that. Some of us don't seem to get that, and they're a bit slower and need to press our alarm clock 3 times to get out of bed. But there is also the correlation. So this cortisol rise in the morning wakes us up. This is where, so whenever you need to take steroid medication, it's best to take that in the morning at the same time as your body's normal cortisol production, because the cortisol keeps you awake. So I always tell people who take steroid medication, always make sure you take it, all of it, in the morning. Otherwise, it's going to stop you going to sleep later that night. It is also the reason why there does seem to be a sort of 24-hour sort of variation in when people have heart attacks and other conditions, because that cortisol rise in the morning quite often can cause some heart attacks in people. But yeah, some people are morning people, they get that cortisol rush. Other people, it's a bit more slower, and we need to get up and we need to take our caffeine as our cortisol supplement to wake us up and get through the morning. And then during the day, we have all the other hormones taking place, and one of them is our serotonin. And serotonin actually breaks down into melatonin. And this, the amount of production of the serotonin and the melatonin is dependent on light coming into your body. So light coming in through your eyes into your body helps with the letting your brain know whether you should be awake or should be asleep. And as the sun starts to go down in an evening, melatonin production goes up, makes you more sleepy, and then the melatonin helps your brain go into a state where you're more likely to be able to sleep, go into a dream state, have your REM sleep, have your deep sleep, and go through, which is one of the reasons why people are finding, if you're continually under artificial light all the time, or you're continually on your blue screens all the time, that melatonin production may be reduced. And so one of the first things to always suggest with people that are struggling to sleep is sleep hygiene. And that is to ensure that in an evening you are preparing your body ready for sleep. So you're reducing that amount of artificial light, you're reducing the amount of blue light, you're providing your body with a pattern of, it knows that we're going to do this, and this, and then we're going to go to sleep. So a nice warm bath, maybe a bit of exercise early evening to sort of tire you out, going through and going to sleep. However, some people have different circadian rhythms, and this is probably a natural defense to when we used to live out in the wild, as in you would need certain people that need to be that morning person, need to be up first thing in the morning so that they can be doing all the jobs and keep an eye on the campsite first thing in the morning. People that are good during the day, and then people that are good late evening and overnight, who therefore keep the camp safe over the night. So you do have, people that are good in the morning, people that are good at the night, and that variation within a set of people is good for the whole community. And then us suddenly having to say, no, everybody's 9 to 5 job, that's that. Doesn't suit everybody. And then obviously we then have shift workers. And again, shift working totally throws out any sort of circadian rhythm that you have as well. And go. So when melatonin was first looked at, it was for the treatment of jet lag and shifts, changes in shifts. So that's where it was first studied. And yes, it does work. So obviously when you've got jet lag, you've gone from the sun giving you one set of signals to the sun giving you another set of signals, and it takes a while. And then just having that melatonin in an evening to help remind your body this is when our melatonin spike should be, get you back into a routine. And it does seem to provide some benefit there. Again, with shift workers, sometimes it provide that melatonin spike when it should be. So that's where it was first used. I'm just trying to think where, I'm just checking on all the questions to make sure that I cover anything. So yeah, so some people melatonin it works for. Oh, I've just lost my chat. There we go. All right. Okay, so it's over the counter in Canada. So obviously it's similar to the US. Yeah, so yeah, the other thing with melatonin is whether there's a placebo effect or not, which is also one of the things with stopping melatonin as well. Obviously, everything can potentially have a placebo effect. So somebody can take it, think it's going to work, and then it helps them sleep. And because they've reduced their anxiety levels by thinking they're going to get help sleeping, it can then help sleeping because you've actually had that lowering of the anxiety that's keeping you awake. Shelby, whether you're releasing cortisol multiple times, probably not releasing cortisol multiple times in the night, but you may be having something else that's causing you to wake multiple times in the night. So some people who have got problems with urine retention may need to get up multiple times in the night, especially if they're already a light sleeper. There's probably many people who can understand what I suffer from, which is nicknamed pain insomnia, which is due to having a chronic illness and chronic joint pain. That keeps me awake at night. So that continual stimulus into my brain all night keeps me awake. So quite often people being woke multiple times in a night, it might not necessarily be cortisol, although it could be cortisol if you've got something that's keeping you anxious all the time. So people that have got anxiety, either due to actual things that are currently happening in their life or because of an anxiety disorder, that raised level of cortisol may keep you awake at night. Yeah, morning people annoy me, but I'm sure that other people that are awake all night, when I send messages and memes in the middle of the night, that's why I like all my US friends. You're all awake still at night. Oh, cats' circadian rhythm is totally all over the place. They just want to have sleep, attention when we're asleep. So yeah, so the lights, it can be used both ways. So as well as I've just been saying, making sure you have dimmer lights and reducing your bright lights in an evening, other people, and there's good evidence for this for the treatment of seasonal affective disorder, which happens in a winter when people are getting less light in the very northern hemisphere, probably more Canada and UK, but in the northern states. And having a bright light in the morning can really help. I have one of those lights that is a dawn waking light. So over half an hour, it switches on to a nice bright sunshine white light. So, okay, so in Canada, okay, Kelda. Oh, so yeah, so you can. Yeah, so some people can have benefit from the melatonin, some people can't, and it depends on your own circadian rhythm. And what you're doing is you're trying to replace where your melatonin should happen if you don't have that rise. Although it's not actually works as a sleeping tablet, it's more that it's working as a brain signal to let your brain know that now it is nighttime, now you need to be going into a phase of sleep. Unfortunately, if you've got things going on that are going to keep you awake, if you've got anxiety levels and your body's cortisol's raised because of that anxiety, that will override it. If you've got pain and other symptoms that are going on that are keeping you awake, that will override it. If you just blatantly want to override it, you can override it. And we all know the kid that wants to try and stay up and they get overtired, but they will keep themselves awake. And you can override it, even though your body might start objecting. So, yeah, so some people, even the melatonin doesn't work. There is also the problem is you're replacing the spike. Now, what happens with some people is that they'll use the melatonin, didn't quite get what the effect, and they'll use higher and higher levels. And actually, anything over 10 milligrams of melatonin isn't going to work on long term, because although it will give you a spike at night time, it will never actually get fully out your system during the day. So what will happen is the next night it will maybe spike even higher, but your baseline of your melatonin will end up being the same, that your body will just end up ignoring it. So just increasing the dose of melatonin to think it will work doesn't always work. So the main areas where people are now using melatonin is in ADHD. Twofold, the people with ADHD don't seem to have the same melatonin boost that most people have with the way that brain works, and so they need to have that. The same with other people with autistic spectrum disorders. Some of them just don't have that melatonin circadian rhythm and need it to supplement. Also with people with ADHD, if they are on medication, a stimulant medication for that, sometimes to help counteract that in the evening, they need to have the melatonin to help move it away. So, Alexis, we're talking about melatonin. So, yeah, so they can be used for melatonin. So when it comes to melatonin in the UK, and I don't know how many of you currently are in the UK, it's not available to buy over the counter. The only way to get it is either on prescription, and there is a way to get it over the counter, but that is by using a company that is outside the UK where their regulations are different, such as in the US, and doing an online order. But you have to be very careful because the online order has to just be for personal use in just a dosage that is for personal use for the customers to allow it through. So there is a couple of companies that do that and do melatonin gummies into the UK. But I would always suggest, if you're doing this for a child, always talk to your doctor about that and make sure that the doctor has it documented that that's how you're getting your supply of melatonin, so that you've got it on your records so that you know it happens. So on the UK, the GPs only really have one product that they can use, and it's called Circadin. Obviously, the brand name has gone on Circadian Rhythm to make its name, and it's only actually licensed for people that are over 55 and for very short-term use of just a few weeks. So that's not actually many people. And they went for that licensing because that licensing is easy. Licensing things in kids is so much more complex. So that's the licensing that they went for. And they knew that although that's what they were putting the licensing in for, that's not what it was ever going to get used for. It was going to get used for children. But for the only way for it to be used unlicensed for children was for a specialist to do that. So for the majority of children in the UK where they're having trouble sleeping, they either need to get a referral to a paediatrician, usually if they're on the autistic spectrum disorders and other sleep issues, for them to assess and prescribe it, or if they've got ADHD or other psychological disorders, they'd be going through CAMS, and then the CAMS consultant could prescribe it. But again, it would be off label. And then certain areas have what's called a shared care protocol for the consultant to be able to pass some of that prescribing back to the GP. So the GP can then prescribe it. So the Sicardin comes in a modified release version. So the modified release version is for helping people to stay asleep during the night, especially useful for children where you find that they're waking up at 3 or 4 o'clock in the morning and they just can't sleep through the night. So the modified release helps keep them asleep through the night. So as to get it as instant release for those people that are struggling to sleep, they always recommend crushing it so that you get rid of the coating that's making it modified release to make it instant release. Since then, there has been a couple more companies coming out on the market. Another company came on the market and they only licensed it for jet lag because that was really easy. But jet lag isn't treatable on the NHS. So they then just went, oh, well, we've done it for jet lag, but we know you want to use it in children. So there you go. But that caused a bit of an uproar. But now we've just had two newer ones come on the market. One that's licensed for ADHD in children and one that is licensed for autistic spectrum disorder in children, and they are starting to be used more by the consultants as well. And eventually this usage is going to be traveling through to the GPs. There will be more and more use, but the cost of that is going through the roof for the UK. So I might actually do a video on that and show the costs of that. So let's just try and see if I can catch up with comments again. So Kelda, yes. So yeah, the ADHD, there does seem to be some evidence about sort of the melatonin release in people with ADHD. There's been a lot more research into that. So that is very interesting. And obviously the anxiety that comes along with ADHD, because just trying to live with ADHD in this society does cause anxiety. So I think there's a lot of people where they were originally diagnosed with anxiety and it realizes that they weren't actually suffering from anxiety and depression. They were actually struggling because they're on the autistic spectrum or ADHD, and they're just trying to deal with life and people. So there is a lot of use of antidepressants for off-label for sleep. So a lot of the older tricyclic antidepressants, they are never used as antidepressants now. They are only used as an aid to either for sleep or to help with nerve pain, because it modifies how the signals go along the nerves for nerve pain. So that's your amitriptyline and such like. Yeah. So Alexis, yeah. So diazepam. So the other benzos and diazepam, they were originally the original sleep tablets a long time ago, and so they are still occasionally used for sleep and for anxiety, but they can produce a lot of tolerance. So we don't know when. We try not to use them on a long-term basis. So we should really not be having people that are on them all the time, because you just get tolerant to them, and try and have a gap. And that goes back to where I'm going on the melatonin. We do need to have more studies about how long people should stay on melatonin. Do we get tolerance to melatonin? Should it be stopped? And the new guidance coming out that sort of with melatonin, so people who have been taking it long-term, especially children, every 6 months you should be trying a week without the melatonin to see if it makes much difference. Now, there is some sort of issues with when's the best time for that. So the best time would be when there's no change in routine for the child. So in that theory, it should be during school time, not during holidays. Yet all parents will be so panicked about trying to have a time without it during school when they know that they've got to have the sleepless night and still get the kid to school the next day. So a lot of parents would then want to try and have the holiday off the melatonin during the school holidays when their whole structure of their day and routine is out of kink and their sleep pattern's going to be wonky anyway. So that's going to be hard. So, oh, not that, Kate. Are you meaning about the transgender and under 18s? Oh, and just another point on melatonin. So there's been some studies about whether melatonin delays puberty, because from a child, so obviously a baby needs like 18 hours of sleep a night, whereas an adult only needs 6 to 8 hours sleep at night. And during adolescence, melatonin levels drop so as to that an adult needs less sleep than a child. And then they have found that people that are being treated with melatonin seem to have puberty later, but also those groups of kids also may have had puberty later because of whatever underlying condition that they had. So there's still debate out of there whether it's cause and effect of whether melatonin not dropping is causing the late puberty, or it's the late puberty that's not causing the drop in melatonin, and then whether external endogenous melatonin can then cause an effect on that and delay puberty. Although quite often, if these patients, these kids that are being treated with melatonin, they're probably not quite ready for puberty and struggle with the whole puberty issue anyway. So I'm like, even if it does delay it a bit, is that really a bad thing? That's probably a bit of a controversial opinion, but yeah, that's something we need to do some work on, and we do need to do. There needs to be more studies and research of the whole long-term effect of melatonin, and does it have any adverse effects long term, like with the benzos, which were, you know, back in the 1950s and 60s, people thought they were a miracle. Then we found out about the tolerance and the hangover effects, and they've gone out of fashion. We just need to now know that for new products. Yeah, again, Tanya, yeah, different people with different conditions, yeah, it can affect the puberty and when puberty happens. Right, so obviously in the UK, there had been the whole scandal, which I can't remember the name of it, I should do, about the under 18s service for transgender, and the whole clinic getting shut down, and the whole postcode lottery around the country about transgender children being able to get access to secondary care and specialist support, and then getting access to the puberty blockers. There's a lot of controversy on puberty blockers. I'm going to try and keep out of the controversy and just talk about the medicinal side of it. So puberty blockers are just basically, they're an injection, and it's an injection that's been on the market for decades, used for treatment of prostate cancer and also certain types of cancers in females as well. It blocks androgens, it blocks estrogens, and it just basically is known as medical castration. It is actually also used as medical castration on sex offenders as well, in a non-licensed way. So it just blocks the effects of testosterone, estrogen, progesterone on the body. And it has been marvellous in the treatment of endometriosis, certain female cancers and certain male cancers. And as Kate says, and for the treatment of precocious puberty. So somebody that's starting puberty at 6 or 8 year old, is being used then to delay the puberty to a normal age. Controversially, it has also been used off-licensed for children with severe learning difficulties or severe, lack of mental capacity, so that the carers don't need to deal with the puberty and the child going through puberty as well. And I always think that, if you're willing to use it in people where you're not allowing them to have their human rights, I'll probably get I can't get demonetized. I'm not actually monetized. So it's used there. So then transgender children and transgender families and the healthcare professionals that are working alongside them want is for this to be used in those children to block the hormones so that they've got the headspace to work out whether they want to go through puberty to the gender that they were assigned at birth, or whether they want a bit more space to think about, do they truly want to go through the transition to the gender that they feel they are. So, but unfortunately, because there's been put this whole hold on the treatment of transgender in children while they do a whole review of whether there should be a service, how this service should be, they've totally blocked the use of puberty blockers in under 18s and has left under 18s with no option other than to go through the puberty of the sex that they were assigned at birth. And so Patricia, so those people that actually are saying about the fact that people shouldn't change until they're an adult, the way that they've stopped the service allowing them to have puberty blockers, in a way, have actually stopped them being able to keep that decision until they're an adult. So, or go private. And unfortunately, even going private isn't really an option at the moment, because even the waiting lists for private are horrendous, because even the private sector is struggling, and obviously that's a fortune as well. So so there's a lot of controversy on there, and we really do need this review to happen more quickly, although it does need to happen and have all the correct people who are looking at it from a health perspective put in place, and we need to try and keep politics out of it, personally. I'll tell the politicians what is in the best interest. So I hope I've covered that very sensitive subject appropriately. I've tried to actually keep my own thoughts and feelings out of it, and do it from a totally medicinal point of view. But I do have friends that I do have. My daughter has friends, and I do have friends that are going through this. So I understand that these kids need support, and that's the main things. They need mental health care support, physical health care support, as you said.